Okay, Bio 47, I'm going to review some of the articulations that you need to know for exam 2. I'm going to review them with models because I can't make videotapes of cadaver material, but remember that you do need to be able to identify these structures on cadavers. So the first one is the intervertebral articulations, and these consist of two different articulations between two adjacent vertebrae. The first one is the intervertebral disc. That's the whole structure up here that connects the bodies of adjacent vertebrae. It has the outer annulus fibrosus and the inner squishy nucleus pulposus. So this is a cartilaginous joint and it's an amphiarthrotic joint. So it's made out of cartilage and it permits some movement at that intervertebral disc. The other articulation is at the superior and inferior articulating facets on the vertebral arch of the two adjacent vertebrae. And there's one on one side of the spinous process and one on the other side of the spinous process. So two adjacent vertebrae articulate at three different points. And these two are diarthrotic or synovial joints. There are some ligaments that support these three joints between adjacent vertebrae that you'll need to identify. The first one is going to be one long band of fibers along the anterior side of the vertebral bodies. That's the anterior longitudinal ligament. So on the anterior side, that's the opposite from the spinous processes. Inside of the vertebral canal on the posterior side of the vertebral bodies, you're going to find another long band. That's the posterior longitudinal ligament. So it would be running through the vertebral canal right there. So you're going to see just one long band. The next one is the Ligamentum Flavum. The Ligamentum Flavum connects the laminae of adjacent vertebrae. So it'll be right here in the laminae of adjacent vertebrae. And this is occurring in segments. So the Ligamentum Flavum between individual vertebrae. The last ones connect the spinous processes of adjacent vertebrae. One that's found in bands here is the interspinous ligament. So you'll find interspinous ligament here, interspinous ligament here, interspinous ligament here. And then one that runs all the way down the back, that's the supraspinous ligament. So all of those are stabilizing the vertebral column. The next articulation that you need to know about is the knee joint, or the tibiofemoral joint. So this is a model in which the patella has been reflected downward, and that means that we're missing the tendon that would be coming down here, holding the patella in place. That's the quadriceps tendon. Then the quadriceps tendon attaches to the patella, and then the patellar ligament attaches to the tibial tuberosity of the tibia. On the outside of the joint capsule, you're going to find two stabilizing ligaments. One of them on the tibial side is this really big, wide, broad, flat ligament. This is the tibial collateral or the medial collateral ligament. And on the lateral side, you're going to find this shorter, narrower one that on the cadaver material, you're going to be able to put a probe under, like you wouldn't be able to do on the medial side, and that's the lateral collateral ligament, or the fibular collateral ligament, because it's on that fibula side. Inside of the capsule, there are two stabilizing ligaments. One is the ACL, that famous ligament of the knee. That's the anterior cruciate ligament, because it makes a cross or an X with the posterior cruciate ligament. So in the back here, you can see a section of the posterior cruciate ligament, and then just a little bit of the anterior cruciate ligament from this posterior side, back there in that intercondylar fossa. Other features that you should be able to identify on the knee, on the tibial side, that is the medial side, you'll see the medial meniscus, and on the lateral side, the fibular side, that's the lateral meniscus. Some features that are not present on this model are up here above the patellar surface. That's where you'd find that open space where you could slip your finger under the quadriceps tendon. That's the suprapatellar bursa. And then down below here was that region of adipose tissue that you had to fold away to expose the ACL. That's that infrapatellar fat pad. So it's not present on this model because we're not showing any of the soft tissues. So let's keep moving down the leg and get to the ankle joint, or the talocrural joint. And this is a joint that is securing the ankle, and there's a high ankle joint and a low ankle joint. The high ankle joint is the tibiofibular ankle joint. It's a fibrous joint. It's amphiarthrotic, so it's made out of fibers, doesn't allow a lot of movement. It secures these two bones really tightly together. And it has three stabilizing components. The first one is the interosseous membrane that knits the tibia and the fibula really closely together, so it's a thick binding connective tissue between these two bones. Then there are two ligaments that tie these bones together. One is the anterior, so on the anterior side, tibiofibular ligament. So you're looking for a ligament that connects the tibia and the fibula. And then if I turn it to the posterior side, there's a posterior tibiofibular ligament. You're looking for shiny fibers that connect the tibia and the fibula on the posterior side. So that doesn't allow for much movement, but the ankle does function as a hinge joint with those two bones articulating over the surface of the talus, that top ankle bone, and it's stabilized on either side, the medial side and the lateral side, by a few ligaments that prevent and limit side-to-side movement. On the lateral side, for this low ankle joint, there are ligaments that connect the fibula, because that's the lateral bone, to these bones of the ankle, the talus and the calcaneus. The first one, right here, it's going to be shiny fibers that connect the end of the fibula to the talus. That's the anterior talofibular ligament. If I move to the side, I can see fibers of a ligament that are connecting the fibula to the calcaneus. So that's the calcaneofibular ligament, again securing the fibula on the lateral side. And then if I look on the posterior aspect, I'm going to see a ligament that connects the fibula to the talus on the posterior side. And that's a little bit more difficult to see on this model, but it's going to be running down from the fibula to the talus. So those are the lateral ligaments, three of them securing the fibula to the bones of the ankle. On the medial side, there's a broad three-part ligament that connects the tibia to the calcaneal bone and to the talus. This is just called the deltoid ligament. You're not going to identify individual parts. It looks sort of like a triangle. That's a delta, so it's deltoid ligament that's securing that medial side of the low ankle joint. Okay, the last articulation that you need to know is the glenohumeral joint, or the shoulder joint. This is a ball and socket joint, one of the most mobile joints of the human body, and it's the head of the humerus articulating in the glenoid fossa of the scapula. And this is a really unstable joint. The head of the humerus is too big to fit in the glenoid fossa, so it's sort of like sitting a golf ball on a golf tee. In addition, the articular capsule is pretty loose, so it permits a lot of range of motion. That means that there's going to be a lot of structures that have to support this joint and maintain stability, stop the humerus from popping out of the glenoid fossa. So one that you can't see here, but you will be able to see on the cadaver material because I can't pull the humerus out, is the glenoid labrum. The glenoid labrum is a lip of cartilage around the outside of the glenoid fossa. It's functioning similarly to the menisci of the knee. It's making the shape of the fossa a little bit more rounded, C-shaped, holding the head of the humerus a little bit better. So you're going to look for that glenoid labrum, that cartilage that's around the outside of the glenoid fossa. Then, if I look at the outside here, so I've got the humerus, I got the clavicle, which has been cut, I got the scapula, and there are some ligaments that are thickenings of the joint capsule that stabilize this articulation. The first one is this one right here, which extends from the coracoid process of the scapula to the acromion process of the scapula. So it's connecting the scapula to itself, which is pretty weird, but what it's doing is preventing superior motion of the humerus. So it stops the head of the humerus from popping superiorly up. So that's the coracoacromial ligament right here, passing from the coracoid process to the acromion process. The next one to identify is the acromioclavicular ligament. This is passing from the acromion process of the scapula to the acromial end of the clavicle. So it's securing the clavicle here at the acromion process and limiting its movement. And the last one is the coracoclavicular ligament. The coracoclavicular ligament secures the clavicle to the coracoid process of the scapula, and it's limiting their relative movement to each other. So all of these ligaments are named for the parts that they're connecting. Other features that we identified that are stabilizing the structure are these 4 rotator cuff muscles. You don't need to know the specifics of the rotator cuff muscles yet, but you do need to know that it's a set of 4 muscles that originate on the scapula and extend across the glenohumeral joint to the head of the humerus and to the greater, lesser tubercles of the humerus, this proximal end of the humerus. And what they do is they have broad, flat tendons that extend over that joint anteriorly, superiorly, posteriorly, and inferiorly. And what they do is form a cuff of connective tissue around this joint, and that stabilizes the joint. So those 4 muscles are infraspinatus in the infraspinous fossa, so that's supraspinatus in the supraspinous fossa, infraspinatus in the infraspinous fossa, teres minor, which attaches down here at the inferior angle, and subscapularis in the subscapular fossa. Then there are a couple more muscles that have tendons that cross this joint, so their tendons provide some stability by limiting movement. One of them is the tendon of Biceps Brachii, which is coming up here through the intertubercular groove of the humerus, and it's going to attach at the supraglenoid tubercle, and that's going to provide some stability across this joint. On the posterior side, we're going to have Triceps Brachii, and it has a long head and a tendon that extends all the way across this joint to the infraglenoid tubercle, just below that glenoid fossa, so that crosses the joint and stabilizes it as well. Illustrated on this model in green are some of the bursae, those synovial sacs of fluid that protect the rubbing or friction-producing structures of the shoulder. So you can see they occur where we have bone overlying bone, where tendons overlie bone, where bones overlie muscle. You don't need to know specific names, just know the general function of the bursae. I hope this was useful to you. Good luck on exam number 2.